यूएसबी तो डालना पड़ेगा।
कोई नहीं
लिंक नया बनेगा, वही स्ट्रीम चल जाएगी, कॉपी कर लो इसको।
कर लेंगे तो
स्ट्रीम कॉपी कर लो ना।
अच्छा हाँ ऐसे कर
स्ट्रीम यही लिंक कॉपी कर लो ना स्ट्रीम का। कहाँ से करो? ये कॉपी करो,
ये लो ना, देख के डाल देना है ना।
अरे यार छोड़ो,
कॉपी फिर उसमें कैसे लोगे?
मैं आप करो तो मैं ले लूँगा ना,
सेंड मार देंगे ना।
कॉपी ये टेस्ट करो।
अच्छा
इससे मेल कर दो, सेंड सेल्फ को ही कर दो। और बोलिए, इसमें मेल आईडी खोलनी पड़ेगी। है इसमें मेल आईडी खोलनी पड़ेगी, खोल दे।
तो बात तो एक ही, अगर मेल लॉगिन करोगे यूट्यूब भी आ जाएगा।
अरे यही सेम स्ट्रीम नहीं आई तो
आएगी ना, क्यों नहीं आएगी?
पक्का।
हाँ हाँ
आवाज आ रही है इसमें?
ये लैपटॉप का माइक चल रहा है ना।
अरे ये डार्ट इसमें लगाओ, तो चेक करो, ये दो ही लगाओ इसमें, और यहीं चेक करो फटाफट। ये
क्या?
एक
अच्छा अच्छा अच्छा,
दरवाजे यूएसबी में लगाए, उसमें लगाओ, कोई से
स्मार्ट स्मार्ट स्मार्ट।
और दोनों दोनों ही लगा दो, ऑडियो और साउंड बार ही लगा दो। ये वाला लगाओ,
लगाओ उसके।
नोटंकी करा, आवाज कैसे करा? वही आवाज हमारा घुमा के सही।
अरे वो इंटरनल माइक है ना।
उस वक्त सारे सारे पापड़ बेल लिए थे। आप अपने फोन में खोलो फटाफट। क्या बोलते हैं?
अरे अभी तो कुछ बज ही नहीं रहा ना, कुछ म्यूजिक प्ले कर दो।
ये ऑडियो कहाँ उठा रहा?
ये तो लैपटॉप
हम लोग बात कर रहे हैं लैपटॉप में माइक से। अच्छा ये ऑटोमेटिकली स्पीकर उठा रहा है। क्या कर रहा है? दरवाजा खुलवाना पड़ेगा यार ऑडियो।
क्या? हाँ सही बोल रहे हो। सपोर्ट नहीं कर रहा।
सपोर्ट कर ही नहीं रहा।
हाँ नहीं कर रहा। देखो ना।
the dignitaries to proceed towards the felicitation section. Ladies and gentlemen, we now come to a special moment in our program. The felicitation ceremony where we recognize and honor the outstanding contributions of the state surveillance officers from each state and union territory under the IDSP program. These dedicated professionals have been the backbone of our effort, working tirelessly to monitor, prevent, and control national health challenges across the nation. Their commitment to ensuring the health and safety of our communities has been invaluable. And today, we take this opportunity to acknowledge their remarkable service and dedication. As we begin this ceremony, let us show our appreciation for their unwavering efforts in strengthening our national health surveillance framework. It is an honor to celebrate their achievement and dedication to the cause of public health. Now, may I please request all the representatives from the states alphabetically to kindly come onto the stage for the felicitation ceremony. May I now start with the representative from State Surveillance Unit. May I request the dignitaries to kindly do the honors. We start with SSU Andaman and Nicobar. May I please request all of you to please put your hands together for SSU Andhra Pradesh. Next in line is SSU Arunachal Pradesh. Thank you so much. May I request SSU from Bihar to kindly be ready to come on to the stage. Congratulations, sir. May I now invite SSU Bihar for the felicitation. So this is SSU from Andhra Pradesh. SSU Bihar. Thank you. May I request SSU Chhattisgarh, representative of SSU Chhattisgarh, to kindly come onto the stage. Today, audience has a lot of work to do, perhaps. Thank you so much. Congratulations, sir. May I request representative of IDSP Delhi to come onto the stage for the felicitation. Please give them a round of applause. Thank you. May I now request SSU Goa to kindly come onto the stage. The next in line is SSU Gujarat. IDSP Goa, ladies and gentlemen. IDSP Gujarat, please come onto the stage. It's a great honor to have all these people here today. It's their effort that has led to the success of this program. May I request representative from Haryana to kindly come onto the stage for the felicitation. Thank you so much. May I request representatives from Himachal Pradesh to kindly come onto the stage. This indeed is an acknowledgement of all their efforts at their state levels. May I request SSU Jammu Division to kindly come onto the stage for the felicitation. Next is the representative from Kashmir Division. Thank you so much for being here today. And for all your hard work, this indeed is an acknowledgement. You all deserve it. Next, may I request representative from Jharkhand to kindly come onto the stage. Yes, ladies and gentlemen, this is representative from Jharkhand. Yes, representative from Karnataka to kindly come onto the stage. Thank you so much for being here today, taking out your time and gracing this occasion. Yes, ladies and gentlemen, this is Karnataka coming onto the stage. May I request representative from Kerala to please come onto the stage for the felicitation. Ladies and gentlemen, the success of this program is really not possible if they were not there. At each state level and union territory levels, these are the people who are taking care of this program. We do not have representatives from Ladakh, Lakshadweep. May I request representative from Madhya Pradesh to kindly come onto the stage for the felicitation. Oh, thank you so much for being here, sir. This is IDSP Madhya Pradesh. Representative from Maharashtra couldn't come over. I would request representative from Manipur to kindly come onto the stage. Yes. Thank you so much. Yes. Ladies and gentlemen, IDSP Manipur. Yes. Please give them a big round of applause. We have representatives from Meghalaya in her traditional dress. Thank you so much for being here, ma'am. Thank you. Thank you so much for being here. This is IDSP Meghalaya. We also have representatives from Mizoram. I request you to kindly come onto the stage for the felicitation. Yes, representatives from Mizoram, please come onto the stage. This is a day of celebration, I must say, acknowledging everybody's efforts, hard work. Thank you so much. May I request representative from Nagaland to kindly come onto the stage. Again, in the traditional dress, ladies and gentlemen, I request all of you to kindly acknowledge their hard work. This is the beauty of India. With all its diversity, I would like to tell you that representative from Chandigarh has also arrived. So may I please request representative from Chandigarh to come onto the stage for the felicitation. Thank you so much for being here today. I'm grateful to everybody to have made this event so colorful with the traditional dresses and representing their states. Thank you so much. May I request representative from Odisha to kindly come onto the stage for the felicitation. Thank you so much for being here today. Ladies and gentlemen, IDSP Odisha. It's a great honor to have representatives from Puducherry. Do we have Puducherry? Please come onto the stage for the felicitation. Thank you so much for being here today. Ladies and gentlemen, IDSP Puducherry. May I request a representative from Punjab to kindly come onto the stage for the felicitation. The next in line is representative from Rajasthan. Please come onto the stage. Thank you so much for being here today. The SSU Rajasthan. Yes, ladies and gentlemen, thank you so much for encouraging them. May I request representative from Sikkim to kindly come on to the stage for the felicitation. Thank you so much for being here, taking out your time. IDSP Sikkim. May I request representative from Tamil Nadu to kindly come on to the stage for the felicitation. Thank you so much for being here today. Thank you. Ladies and gentlemen, Tamil Nadu. We have representatives from Telangana. Please come on to the stage to receive the felicitation. Thank you so much for all your hard work. IDSP Telangana. I was thinking after the tea break, people would be more energetic. Can we have a louder round of applause? Thank you so much. May I request Dadar and Nagar Haveli representatives to kindly come onto the stage. Thank you so much for being here, flying all the way from there. Thank you. Ladies and gentlemen, let's clap for them. Thank you. May I request representative from Uttar Pradesh to kindly come onto the stage, and Uttarakhand. Representative from Uttarakhand. Okay. Yes. IDSP Uttar Pradesh. Thank you so much for being here. Yes, ladies and gentlemen, let's give them a round of applause. IDSP Uttarakhand. Great. Thank you so much. Thank you so much. Thank you. I thank all the... Okay, we have representative of West Bengal here. Ladies and gentlemen, I request representatives of West Bengal to kindly come onto the stage. All right. Thank you so much. Dignitaries, I request you to kindly take your seats. While I was just announcing about, the different states, I remembered once Emperor Jahangir once had said, Gar Firdos Ruhi Zaminast, Haminasto, Haminasto, Haminasto. It means if the heaven is there on earth, it is here, it is here, it is here. So we celebrate India as one, and I'm sure all the states and union territories are doing their bit, and I'm sure you all are doing very well for the success of this program. So congratulations to all the states and union territories. Thank you so much. And I thank all the dignitaries to be very patient and nice enough to have, felicitated all of them. So here, I would like to now hand over for the technical session. Dr. Himanshu, over to you.
Thank you very much, sir. Thank you so much. Thank you, ma'am.
Congratulations.
Thank you so much, ma'am. Please. So this brings us to the formal conclusion of our inaugural ceremony. We now have 3 technical sessions lined, or rather it's 4 if I look at the number of sessions. So the first technical session and the one before lunch is about the newer initiatives of IDSP. As we have seen that in the last 3 years since the launch of IDSP reporting on IHIP, communicating with the states, being responsive to their needs, analyzing the information that we were getting, we have continuously synced and fine-tuned our platform so that it can best cater to the needs of not only the national level users, but state and district level as well. So with that objective in mind, new features have continuously been added to the platform, and to give us an overview of what are the newer initiatives of IDSP, including the tweaks and the changes that have been made on IHIP. I'd like to invite Dr. Devang Zariwala, and along with him Dr. Shyam Singhal from WHO. They have a small presentation cum demo of these newer features which have been added on. Yes.
Very good afternoon to all of you. So you have all witnessed the celebration and along with the launch of the P&L Form app. So we will just briefly touch about what is P&L Form app, and immediately after the launch, the app is also available on Play Store. So what was the rationale? We had a lot of feedback from the field that even after, of course, a lot of many PSCs have the access to desktop and laptop and all those things, but still at every facility there were some challenges, like for example laboratory technician. So because the PSC data entry operator or PSC desktop is always busy with so many programs, the laboratory technician used to say, so laboratory technician always used to complain that we have if you have a separate desktop for us, but of course that was not possible. So we come up with the idea of the P&L Form app, and there were a lot of reasons for that as well. Okay. In addition to being accessible, it also has the real-time data entry. Of course, you can do instantaneous reporting, and the most important is the offline functionality. So in far rich areas in PSCs where there may not be good connectivity, so they can just save and submit the cases offline, and whenever they have the internet, they can just save the data to the server. So that functionality is an added functionality to the P&L form, which is there in the web portal. And of course, simplified user interface. We will see how the simplified user interface helps you. It has enhanced security and privacy control as well, and of course, because of we always have a low resource setting, so it has a better usability. And an Android device is almost available to each and every person, so they can just, and it does not consume a lot of data as well. So with a lot of data that each person have, I think this is possible as well. Okay, so this is the first login. You have to put your username, password, which the P form and L form user usually puts on. The same thing, CAPTCHA, and you click on the login button and you accept. The only difference is whenever you will log in for the first time, it will take some time because it downloads some of the important data like local government directory data. So it does take time when you will log in for the first time. This is the home menu. There are many important buttons on your home, and it also shows you the graph of your data entry. So your weekly data entry, your monthly data entry, that keeps you on track that how many cases you reported this week or this month. And you have a lot of functionality here as well. You can just from the home page itself, you can start click on the add patient button or add death and report nil. You can directly do that. And whenever you have line list, you have saved the data, you can go to the line listing button and you can submit it. Next, please. Okay. So this is the add patient. The things are very much similar to portal, but for the user interface, for user experience, what we have done, whatever is minimum required and whatever is minimum being entered usually on the web portal, on the basis of that, we have hidden some of the data fields. Suppose, for example, first name, it is the mandatory field, so it's there. But if you want to put the middle name, last name, you just have to put the drop down arrow on the right side. Okay. Similarly, with other data fields, to keep the user interface simple, we have done it. Lab user, because lab user usually have to update the results, what they need to do is just click on the line listing button. The all line list which they have received from the P form user, it will be listed. They have to just click on it, then click on the edit button and update the results of the sample. So the user interface is very much easy and simple. And then you click on the submit button. There is one extra step here on web portal. When you submit, the things are submitted as such, but here you have one more extra step. Why? Because we have made it offline. So once you save, you need to submit it. Once you submit it, you cannot change edit anything after that. But before that, before you click on the submit button, you can certainly change if you have made any mistake in the data entry. But once you submit, it is offline submitted in your user account, and once you have good internet connectivity, you can click on the sync button and that data will be uploaded to the server. We also have the nil reporting button. So if no case is there for today, then you can simply click on the report nil and click on the accept, and your report nil button will be done. Event alert, it is same as you have on the web portal. All the data fields are same. There is nothing different. It is very much similar. Even IDSP S-form app has the event alert form. So it's similar to that. So you similarly you fill in whenever you come to know about any particular potential outbreak. You can fill in all the data fields and you can just submit it. User profile, this is somewhat different from what is there in the IDSP S-form app. In IDSP S-form app, we have not provided the user profile details to make it light, as light as possible, because it is being utilized by the field workers in the sub-centers and villages. But here we have provided it. I think this is very much useful whenever the user is changed. What I would request that you make sure that user profile is updated, especially the mobile number and email ID, because if the user forgets the password, that mobile number receives the OTP whenever you click on the reset password. So if you want to reset password in the future, if you forget the password, then your mobile number will help you, but that mobile number should be updated on the user profile. So now the next session, which is the next feature, which is new feature, is that cross notification will be taken by Dr. Shyam. Thank you.
Thanks, Dr. Deva. Regarding this feature, already that is there, so most of you have already seen it. That was implemented around 1 month or sometime before, so that has been updated also. I'll just take you through that. Next, please. So actually, cross notification is a broader term. So what it means for the currently for the IDSP IHIP portal is that, see, cases are being entered by the health facility. So health facility has a location. So one way is that we can show the cases on the basis of the reporting health facility from where those cases are getting reported. Second thing is that in the portal we are capturing the patient address also. So patient address may be different from the location of the health facility. So that was requested by many states also. They want to see as per the see the cases as per the patient location, and that is a mandate of the surveillance program also. We want to show the cases as per the location of the patients also. So this feature has been introduced. Previously all the cases were showing in all the reports as per the location of the reporting health facility. Now this function is there, we can segregate the case, means we can show in two ways. One is as per the location of the reporting health facility also, and second is as per the location of the patients. So whenever a patient is reported by a health facility from a district, but that patient belongs to some another district, not the district of the reporting health facility, then it is called here on the portal right now as a cross notification, right? Next, please. So here you can see some small, I cannot point out, but you can see on the, just below the filter options, there are some small checkbox are given where there are three options. Locally reported patient, that is resident. So locally reported resident means is कि health facility is located in the same district where that patient belongs. So patient address and health facility address are belongs to the same district. Then it is locally reported resident patient. Second option is cross notified in. So cross notified in is that that is not reported from the health facility of that particular district, but reported from out of district, but belongs to currently whatever district is selected on the top filter. So that patient is belong to that district, but has been reported from the some health facility from the out of that district, maybe out of the state also. Third is cross notified out. So cross notified out is the patient which is reported from the district which is selected on the top filter, what that does not belongs to the same district, patient addresses of the another districts. So these three options are there, and by selecting these means a particular one or two options, we can segregate the patient based on the either location of the health facility or location of the patient. So right now here in the selected option, two options are selected there. On the top you can see state, just to explain in brief, state is selected as a Delhi, no district is selected, none of the district is selected, and locally reported resident patients are selected and cross-notified in is selected. So in this selection, all the patients of the dengue for the particular duration which belongs to Delhi will be shown, will be filtered out and will be shown in this particular dashboard. So in the map you can see with this filter, we can see location of all the patient is within the Delhi. So this is one option. Next please. Here you can see first and third option is selected, that is a local resident patient and cross notified out. So in this, patients are reported from the Delhi, what they may belongs to the Delhi and may belongs to the outside also. So this is a major issue with the metropolitan areas or big cities, there are so many cases, but because there are all the referral cases are coming to that area, but those cases may not belong to them. So here you can see with this and Delhi is the state selected, you can see most of the patient belongs to the Delhi area, but there are so many patients from the outside Delhi also. So by checking out that option, we can exclude those patients, right? So right now in this report, all the reported cases from the Delhi are shown that may belong to the Delhi, may be resident or may be cross-notified out also. Next please. So in summary, there are two options, major two options. In one, we can select patient with the Delhi address reported from anywhere. And second is patient reported from Delhi, but patient address may be anywhere. And selectively, if you want to filter out only cross-notified in only, that can be selected also, cross-notified out only, that can be selected, and respective line list can be generated also on the portal. Thank you. And similar, this was the disease dashboard, and similar options are available in the consolidated disease summary reports also. So here also you can select as per your means whatever is demanded, what is needed, and you can generate the respective line list also. Thank you. And for community reporting, I will request Dr. Devang to take.
Thank you, sir. So, this community reporting tool was launched by Honorable HFM on 2nd January this year itself. And because it was, not picked up so much, that was the reason that the IAC material was launched in different languages. We are also going to put community reporting tool itself in different languages. We have already shared all those details for at least 6 to 7 regional languages. So community reporting tool will also be available in different languages so that people can report from community as well, because they may not understand English well. Um, Yes, so on the IDSP IHIP homepage, you will see this red color icon which is marked as community reporting, and if you click on report outbreak or event, you will be directed to the URL. Or if you know this URL for community-based surveillance, you will be directly directed to the community reporting tool. Next, please. Yeah, so this is our community reporting tool. Whenever you go to the community reporting tool, there will be some notice, and you will be given some, background about this community reporting tool, followed by two boxes. The first box is details of the reporting person, and the other part is event or outbreak details. So event and outbreak details is very much similar to event alert form. Okay. It does not have any big differences, but in addition to that, because it is being reported by a community person who does not have access to the IDSP IHIP portal as such, they do not have the user credentials, but they can put in their details like name, age, gender, all those details, and the most important ones is the mobile number, because that mobile number will be receiving an OTP. We want to make sure that whoever is reporting is an authentic person and is also genuinely reporting what is required out of the program, like if it really matters to the health of the people, especially the outbreak prone diseases. Next, please. So this is how you fill in the reporting person details, and then you fill in the event or outbreak details. You put the CAPTCHA and you put the OTP that you have received in the mobile number, okay, and then you click on submit. So this event, community reporting or community event will be reported to the district. Whatever district you select here on this event or outbreak details box, that district surveillance officer will receive that community alert on outbreak summary page. Next, please. So this is the outbreak summary page. Under the outbreak summary, under the outbreak module, there is a separate sub-menu, community reporting, and there district surveillance officer can see all the community alerts which has been reported for their district. Now here district surveillance officer needs to respond to this particular community alert. They need to click on it, and next. Yeah, and this dialog box is very much similar to, whenever you convert an event alert into an outbreak, or you maybe you close the event alert. This is very much similar to that, but it's not that. It's a community alert in which the district surveillance officer is responding that whether this community alert needs to get converted into an event alert. So this community alert is more like an pre-event alert. Okay, so you must be knowing that district surveillance officer responds to the event alerts and health condition alerts. Either the district surveillance officer discards the event alert, or it converts that into the outbreak. Okay, based on the epidemiology and the about disease epidemiology in that particular area. Okay, here it's one step before that. So this community alert, district surveillance officer needs to respond whether this really needs to be converted into an event alert or it needs to be discarded. So based on the information received, and maybe district surveillance officer can also call to that particular person because that mobile number is available. So those extra details can be gathered from the same person by calling that person, and once this is done, then district surveillance officer decides whether this particular community alert needs to get converted into an event alert. Okay, once it's converted into event alert, then DSO needs to respond to event alert just like the other event alerts. So this is like a pre-event alert. Okay, so it will generate an event alert if DSO selects yes and clicks on the submit. Next, please. So this is how the community event alerts looks like if the DSO has closed it. So you will, in the action column, you will see it as closed. But if it gets converted into an event alert, So you will see that particular event alert ID followed by EA, means event alert. So this is how district surveillance officer can, track all the community alerts that has been reported for their districts. Next please. So this is in nutshell about the latest features on IDSP IHIP. If you have any queries, we are here to give you the answers.
Good afternoon, everyone. So, since these are the newer features of IDSP IHIP, we would like to expect comments from all the participants. Initially, I would request our senior sirs here, Dr. Sujit sir, Dr. Jagveer sir, Dhariwal sir, for your expert comments on improving the same so that these can be rolled out across the country, sir. Sir.
The identity of the patient, whether you are really disclosing the identity of the patient on these portals?
Sir, identity of the patient is presently available only at the district level for further investigation and contact tracing level. At the state and national level, that is must. So the thing is, we are unable to see their contact details at the national level. Even if they, when we see at the larger picture, we don't have any identifiers at the national level. Only at the district level, they need it because they have to trace back the patient, as well as they have to do the contact tracing in case of any unusual event or something like that.
Okay. Second, when you see just report the fever, only fever for 7 days, that is, I understand from this S form it has been taken. But once it is confirmed, maybe it is a dengue, then how are you going to link these two patients at the same time?
Sir, since this is a community reporting tool, they may not have the diagnosis at this one. They have been provided with all the syndromic features for reporting at the community level. It is similar to the S form. But the moment, presently what is happening is, sir, the moment it goes for the lab investigation, it is converted into an event from the district surveillance unit. That is, a district surveillance officer will convert that event reported from the community to an event alert and start the outbreak investigation if it is there is a really cluster of the cases. So once this happens, automatically the lab samples which are being collected are linked to the particular case through the format behind, sir. That is a P and L form. The moment they are also tested and they are uploaded from the lab facility, it is immediately seen to the district surveillance officer and the particular health facility from where the case have been uploaded. So they come to know exactly what is circulating. But there is, as such, there is no public dashboard as of now for how the community will come to know whether it is a dengue or this one. It is only through the outbreak that is published on a weekly basis on the IDSP portal, sir.
So, sir, I would also like to add to your query. That's a very specific query, sir, that you have raised. So the idea was that we were missing some outbreaks or some early warning signals from our routine SPL reporting. So later on, event-based surveillance was our major modality, as you are well aware. Sometimes even the event-based surveillance system isn't able to pick up. It was not reported. Smaller events are not reported. So to expand and make it more sensitive, community participation has been sought. Let the community directly report what they are seeing around them. And the idea is that these community alerts are to be investigated. If it is indeed an early warning signal of an outbreak, it gets converted to an outbreak. Then outbreak investigation is carried out. That's where these cases, the fever with rash, are tested, and if it is found dengue, the RRT would update it as dengue cases found so many in number. So the idea is to have early warning signals from as many sources as possible, and community being the one who is facing it directly would probably be able to give much more information. Sir.
Third, I would like to have the feedback from the states. Are they comfortable with all these complicating? See, these forms, they look to be very, very complicated to me. I'm not saying that,
Yeah.
that these are really complicated, but seem to be complicated to me, because I have not been conversant with all these things in the last 10 years. That maybe if the states are comfortable with all this, I would like to have the feedback
that's why,
from
sir, we want to hear
them,
the
that how they
feedback
are
from the
going to
states also.
negotiate with these forms.
Just to add on to that, sir, actually that form we have not explained, but there are only three components in that form. One is reporting person has to identify himself, then where this event occur and what is this event. Only this much information we are capturing.
We have comments from Odisha. Yes, ma'am?
Sir, my humble submission is that we have been reporting through this IHIP, sir, since last 3 years, and we are the districts or the ANMs or the multi-purpose health worker females right down at the health sub-center level are also doing through their Android mobile, sir. And we are able to fill up this form, connect with the laboratory, conduct the laboratory test, then upload it also and do the analysis. Little glitches were there with Dr. Himanshu's and single साहब जो हैं उनके साथ बातचीत करके वो solve हो गया है, लेकिन they are able to enter it and analyze also, sir.
Great, thank you.
Thank you, sir. Thank you, sir. We also have comments from, yes, sir. Yes.
सर मैं बिहार से हूँ
Yes.
और मैं इस कम्युनिटी रिपोर्टिंग को मैं पिछले 4-5 महीने से देख रहा हूँ कि पोर्टल पे अवेलेबल है और आज इसको हम लोग देख भी रहे हैं। इसमें OTP का जो ऑप्शन दिया है बहुत ही अच्छा किया आपने सर, कि कोई रॉन्ग नंबर नहीं डाल के इवेंट अलर्ट या जनरेट कर दे, ये अच्छा है OTP डालना। और कम्युनिटी में हम लोग या स्कूल में या PRI जो हैं हमारे या और भी लोग हैं जैसे न्यूज़पेपर में आते हैं, तो न्यूज़पेपर के जो हमारे रिपोर्टर्स हैं वो भी कम्युनिटी में रिपोर्टिंग कर सकते हैं जाके, तो ये हम लोगों के लिए बहुत अच्छा है और इसे बहुत सारे आउटब्रेक को इन्वेस्टिगेट करने का मौका मिलेगा हम लोगों को। थैंक यू सर।
Thank you very much, sir. Sir, comment, sir.
No, I just wanted to add on to what Dr. Jagvir has already said. I think means S form is linked with L form or S form is then converted into P form and then P और L are already linked. IHIP में वो तो है ही P और L का तो.
Yes, sir.
लेकिन S form मतलब P में convert होता है या फिर क्या है?
Sir, as of now, Dr. Shyam can correct me if I'm wrong. S is not connected to P form, sir.
Nor L form.
But S form is connected to L form in only one condition, that is malaria as of now, because RDT is being tested by the ANM, sir. The moment it is confirmed, because the test is taken as confirmatory by even the program division, sir. So the same S form where she enters as positive, test positive for RDT, it is also linked to the L form so that the same numbers are reflected onto the L form. So that total number of L form, total sample tested and positives we get as a total number, sir.
नहीं, मैं डॉक्टर जगवीर मैं ठीक समझा था ना इसको? तो मेरे को मैं वही बात कह रहा था जो सर की क्वेरी थी, तो उस पॉइंट को मैं जस्ट वांटेड टू क्लैरिफाई टू एवरीवन दैट आवर एस फॉर्म is not directly linked to L form, number one. Number two, even if event form, it gets converted into event and then it is looked upon by the district surveillance unit, where the event itself gets tested and event itself get diagnosed either as dengue or chicken, whatever it is. So I think
Absolutely correct, sir. इसमें एक और चीज होता है सर, जो यस फॉर्म से अगर ये इवेंट कम्युनिटी से आ गया सर, suppose some of these patients of the same village have gone to a particular PHC, and the outbreak has been declared in a particular village or a particular community, we can go back and trace back those patients from the PHC and link those cases onto the outbreak module of the IHIP on the same this one, sir, so that we come to know exactly the total case load of the cluster detected or the event that is we are dealing with. So we have that facility inbuilt in the system, so that every person at the PHC level, if he is nearby of that village, he can see how many cases have been reported from that village with the same symptoms, and he can link them to the particular outbreak, sir.
वो मतलब कहीं पे भी रिपोर्ट हो, टाइम प्लेस पर्सन डिस्ट्रीब्यूशन के हिसाब से हीट मैप जनरेट हो सकता है और कम्युनिटी वाले भी उसमें जुड़ के वी कैन गेट ए क्लस्टर इन्फॉर्मेशन दैट दिस पर्टिकुलर क्लस्टर ऑल्दो कमिंग फ्रॉम XYZ हेल्थ यूनिट्स बट इट इज लोकेशन ऑफ द केस एट दैट पॉइंट कैन बी लिस्टेड.
Yes, sir.
Second aspect which I just wanted to highlight is regarding the potential high threat pathogens, because the diseases which are not covered under IDSP, So how, what type of system, suppose community reports something
Yes.
which to maybe high threat pathogen.
Yes, sir.
So how our system
Sir,
can be
there is one option
geared
in
up for
the,
that?
there is one option available in the syndrome, sir, that we have the unusual syndrome that is being reported, or unusual or unusual deaths that are occurring in the community, or unusual syndrome or symptoms that are being detected in the community. So that can be listed out, sir, but the community cannot diagnose, sir. Community is, it is only, it can give us the particular information.
नहीं, that is correct. जैसे अपना दो diseases हैं अभी, to me, which appear to be of public significance. Number one is KFD,
Yes.
which has spread to 6 diseases, 6 states,
Yes.
51 districts, more than 51, number one. Number two, चांदीपुर,
Yes.
जो अभी अपने गुजरात में रिपोर्ट हुआ, काफी सारी डिस्ट्रिक्ट में. Originally वो नागपुर के पास में से रिपोर्ट हुआ था, 62 में somewhere, and thereafter Andhra Pradesh, or thereafter this. Now, what type of mechanism do we have to see that whether this disease is occurring elsewhere in the country, or we are certain that it is not occurring elsewhere? Through this system, can we have some provision? So if we are looking at future, 33 plus 3 disease conditions, whatever we are doing is perfectly fine. And I think I am quite conversant also and comfortable also with that. But with regard to the new threats, future pandemic preparedness, what I can say, we need to have somewhere, some provision where we can incorporate this, as you have done very nicely during INSACOG time. INSACOG में genome sequencing को हमने time, place, person और case के हिसाब से distribute कर दिया था through this portal only. So alpha strain कहाँ पर है, whether it is vaccinated or not, how many of them, how many Covishield, how many Covaxin, ये हमने सब कर लिया था इससे. So that provision, AMR का भी हमने इसमें include किया है. So means those kind of things, just I wanted to know if you have something in it.
Sir, thank you. Yes, sir, that is because जो program का mandate है, for that the reporting module has been so created that it covers those conditions which are under the program mandate. But then, as you said, there are newer pathogens like Chandipura. So the Chandipura virus can only be confirmed in a handful of labs across the country. What Secretary DHR was mentioning in the morning is that there is a connect between the ICMR lab network and IHIP now. So whatever it is, even if it is beyond our mandate, that information is flowing into our system. So the first person to know about it would be the district surveillance unit, the state surveillance unit. Simultaneously, we would also know. So Chandipura virus detected by any lab, whether it's ICMR network or any other network, it would flow into IHIP, and we will be alerted that a new pathogen has been detected from where it was not reported before. So that mechanism is there, sir. And having said that, the main thing is that while the routine reporting SPL, there are linkages between them, because they are the people who come to the facilities and they are seeking treatment. But the ones whom we are missing out, they remain in the community, or there are some active people in the community, they want to report something which is happening around them. Then that entails an outbreak investigation if it is true. An outbreak investigation module is very flexible. We can add line list cases to it, we can connect them to the lab network, we can have the P form and the L form linked to each other. So that way it is flexible.
Sir, one more thing which I want to add to sir's this one. Sir, presently in the P form also, there is some others column we have provided, sir. In the others, they can add the newer pathogens, as you have said, sir. And if doctor suspects something newer thing, that kind of a thing, he can send them for the lab particular testing. And those labs are also dedicated labs where these tests are being conducted, sir. So automatically it goes to those particular labs wherein the data automatically flows from those labs into the system, sir. So this is one thing. And second thing, if anything like Nipah, which we don't know where in the villages, but it is as of now, sir, Kerala is doing a fantastic job with respect to their suspicion. Suspicion is very important thing where the physician detects those cases on time, sir. So that needs to be there with the health medical care workers, sir.
Thank you very much for the presentation. Nice initiatives. I would just like to dwell on the community-based reporting from the community. Now, coming from the vector-borne disease background also, I understand that there must be some provision to get the report from the community, and particularly school children when it comes down to dengue. Reporting of increased density of mosquito bite during daytime. That could be one of the early warning signals before human cases start occurring. Similarly, there are many instances, means the zoonotic, we have been talking about zoonotic diseases also, so rat fall, the deaths of the birds, etc., means. So I see that probably it would be useful to propagate, first of all, educate, that these are the things community need to watch and need to report. I understand it must be there
Yes,
in the system.
Sir,
but
your comments are very well taken, sir. Because of that only, the IEC materials that we have developed, we wanted to implement them for the school children as well as at the local level, so that they know exactly what needs to be reported and how can it be reported. Because presently they know this is happening, but they don't have the option how it can be reported. So that is a system which can help us, and we want all the SSOs to take further this IEC materials to the local level through your school health program, as well as the mobile health teams that you have, and the Gram Panchayat, or through them also these can be taken to the local level, wherein they have to be encouraged to report. Let them know how to report. Once they start reporting, they will come to know, and it will be automatically taken care of. Yes.
That's good. Means school-based reporting is one thing. Second thing, although not part of the initiative, but we have always been talking about generating early warning signal through our system in place of getting report. And that is where the fundamentals of the disease surveillance, weekly reporting, and now we have real-time reporting. So generating those things, probably documenting would be useful.
Thank you, sir.
So that indicator-based surveillance is something that is the need of the hour now. Automated cutoff values, threshold values, the moment they cross those values, system-generated alerts. So yes, I think now we are ready for that, sir. Dr. Anzin, I think you had a comment.
Thank you very much. My comment was related to the community-based surveillance app that has been generated. So I think this is a welcome step, and this is what is required for making event-based surveillance strong. But I had a point regarding, when you have this kind of community-based surveillance, which is going to be very widespread, what is going to happen is that the signal to noise ratio will get distorted. You'll have a lot of noise, and the amount of signal that you'll be able to pick up from your surveillance will get depressed. So what you need is now a sub-district level verification. Every event that you are able to generate from your system has to be verified for you to determine whether you want to convert it into an outbreak or not. So that verification system has to now come into place at the sub-district level, complemented by this community-based surveillance. And I think that marrying together of these two will improve our system further.
Yes, ma'am,
Thank you.
absolutely. We had thought of this, your point, when we are considering this at the verification at the district surveillance officer units. But what we had thought is initially let the reporting start from the community. The moment the load comes to that level where the district surveillance officer is overloaded with the verification itself, then the next step would go into that particular PHC or the health facility from where that reporting is coming. Let him verify and update and verify that. So this is the next step that we had thought of. Yes. But presently, as of now, since it is recently launched and still we are expecting a load to generate, let it percolate into the system, then it can be done.
So I think the question that is posed is for the states to answer as to how much of an information from the community in the form of alerts, community alerts they are getting, and how are they dealing with it. I have my solution for the signal to noise ratio problem, and I'll offer that once we hear from the states. So yeah, Dr. Padma.
So I'm from Karnataka. So in Karnataka, we have already, 16 of our districts are already reporting the community-based surveillance. So, but we see that most of it is, like Madam was also saying, it is noise. So it was being discarded. So most of it was discarded, but I think it will take a little time for us to get really good signals. So I think it's a process and it should evolve. So this is my comments.
Yes. And presently, this community reporting tool is also converted into 7 regional languages. So this also will help in to know exactly what they have to report at the community level. We are trying to generate in many of the other local languages also. I request the SSOs, if you can convert them into your local languages and get back the copy to us, so that can be incorporated from the back end to your level. So it will help you also, it will help the community for reporting these events onto the portal.
Most of the states have been shared the template, and for some states we have already received but not included yet. We will include it in a while. But for all those states which have not shared the translation, we would urge you to share the translation, and we will implement the same on the community reporting too.
Dr. Yes, ma'am.
Sir, we in Jharsuguda actually in 2 blocks we have started community reporting through Path organization, and we are experimenting that and it is showing good results, sir. There we have identified the persons who have reported. For example, PRI member, Panchayat Raj member, school teacher, then the Mukhiya log jo hote hain gaon mein wo, these 4 to 5 people has been identified and they have been trained how to use that app. And it is, I think, it will be a successful model which can be replicated in other districts also, ma'am. So we have tried. And another my suggestion, sir, if the community app is developed, we have to have a SOP, sir. Who will be the persons who will be reporting? Who will be the recipient? That means community, CSC medical officer or a IC officer at the CSC level, as madam has suggested, to verify the rumors, convert it into event alerts. So that verification is real, because in the current political and dynamics and all playing, sir, lot of rumors will come. So we have to have a verification level at the level of CSC, Community Health Center, where is a medical officer, 2 or 3 medical officer and a public health communication officer is there, so that we can verify, and then it can be conducted, and again the RRT team can move. Otherwise everyone will start using that and giving us a lot of rumors which are not actually clustering of disease.
Right, ma'am. Right, ma'am. But presently, if you are facing, what is the current load? If you can share it with us for each wherein you are facing such
I think they have mentioned that they have just initiated in 2 blocks in Jharsuguda.
Yes.
So it still needs to find ground in the community. So what we hear from the states as well as from our experts who led the program in the past is that there is a need to further expand it at the moment. We are still missing. If we were if we would have this tool widely propagated, then we would not have missed the AES cases in Gujarat. We would not have missed the Goalpara cases. We would not have missed so many unreported cases which then manifested as deadly outbreaks where precious lives were lost. So at the one end, we have that community who is not aware that there is a mechanism to report, while at the other end, we are concerned the overburdening the system with lots of noise and losing out onto the signal. So one of the ways that we can look forward to is having a graded signal intensity in terms of who is doing the reporting. Like you said, PRI or ANM or ASHA, they would certainly not generate a false alert. So if the alert comes from a medical practitioner who's a registered medical practitioner, if it comes from a medical college or a laboratory, then that has to be graded much higher as a potential action point than if it comes from a lay person, or if it comes from somebody who's repeatedly into this habit of generating false alerts. And that's where I think the solution that I was offering, that we would have AI coming into picture. Those algorithms would be picking up as to which phone numbers are those who have generated consistently false alerts and tried to mislead the system and grading down their intensity of signal generation. So a mixed approach. First, obviously, we have to expand, take it down to the community so that they are aware that there is a mechanism to report. And then grading those signals as per the action that they result in. So that's quite interesting. Community participation has always been taught to public health graduates as one of the 4 pillars of primary health care, and very few programs we see or actual implementation of that community participation has been wanting. So this is an approach to address, stick to the basics as they say, that public health के जो 4 primary health care के pillars है, उसको हमने use करने का कोशिश किया है इसके through.
Second one is the regarding the cross notification. I had few points on that. One is, I hope so all of you have understood.
Sorry, before you go on to that, the last point about my suggestion to ourselves is that we also need to complete the loop. People who have generated an alert, they need to be acknowledged, which goes through the system that your signal has been captured, your alert has been captured, this is the reference number, and then once action has been taken, for the ones which are genuine alerts where system has been put into action and they have investigated, then there should be a feedback loop closure mechanism that yes, this action has been taken. Just one line SMS,
Yes.
we have the system for sending SMS, so
But
that should be put into place. Yes.
Second thing is regarding the cross notification. Many of the states were asking regarding the cross notification of the cases that have been reported from the outside, or they were only reported from outside, they were telling this. But what about your cases which have gone from your state to the other state? That is also one thing, or your district to other district. So we have introduced those features here, cross notification, one is in and another one is out. But the features that have to be clearly articulated, kindly ask the DSOs that who needs to be really cross notified and what presently, for example, if a case is staying there for last few months and he belongs to some other state, it doesn't mean that the case is that, again you have to decide what is the incubation period and till what time the patient was staying here. Again, whether to actually to cross notify him or not, that again depends upon the particular DSO or the SSO. We can take a few comments on this because this is very, very important point. Otherwise, everyone will start notifying them out, whether it is, even though he was staying in the incubation period, whether he had been infected here, still they would be cross notified out, which doesn't mean anything for the other district where he or she has been cross notified. Let us have few comments on this.
So the states, we have this natural tendency कि ये तो मेरा केस नहीं है, ये तो दूसरा स्टेट का केस है. कोविड में we have seen it happening time and again. It should not be. या फिर 2 लिस्ट जनरेट कर देते हैं हम स्टेट के केसेस एंड आउटसाइड स्टेट केसेस. So this cross notification thing is an important tool, but to be used properly, as Sanket was referring to. Your comments on that?
In Odisha, we have migration from Ganjam, for example, to Surat and all. For 6 to 8 months they go, they come back. When they have some, when they're in our fold, we report. Then after that, again they go back there, and we have a list of those persons. So we have to take into consideration the border districts, going to that next district for some work, and the long-term migration, like they're going for Surat and all for to clothes mill from Ganjam and few districts, sir. So 2 types of SOPs we need to develop, how to cross-notify, to whom to cross-notify, and about what period. The period of cross-notification has to be also, sir, mentioned in that, because we are facing a lot of problem in that. Thank you.
Sir has a point, sir.
Yeah, I think हमारा 2 पॉइंट बिल्कुल क्लियर होना चाहिए कि हम क्रॉस नोटिफाई किस चीज़ के लिए कर रहे हैं. नंबर 1, उस आदमी को इन्फेक्शन जो हम सस्पेक्ट कर रहे हैं, जो सोच रहे हैं या जो कंफर्म निकला है, वो कहाँ पे लगा. उस पर्टिकुलर पीरियड में जब हम सोचते हैं कि वो विंडो है जहाँ पे उसको इन्फेक्शन लगा होगा, तो वो अगर क्रॉस दूसरे डिस्ट्रिक्ट में, दूसरे स्टेट में फॉल करती है, तो हमको क्रॉस नोटिफाई करना इसलिए क्योंकि वो जो कंडीशंस हैं वहाँ पे, एनवायरमेंटल कंडीशन, एंटोमोलॉजिकल कंडीशंस या कोई और कंडीशन जो आप इम्यूनाइजेशन कंडीशंस कह सकते हो, जिसके कारण कि उस आदमी को इन्फेक्शन लगा, उसको इंटरवेंशंस के द्वारा टैकल करने के लिए. दैट इज द सोर्स ऑफ इन्वेस्टिगेशन, आउटब्रेक इन्वेस्टिगेशन में. जैसे हम लोग केरला में गए थे, त्रिवेंद्रम में, आई थिंक संकेत वाज देयर, जहां हम जीका को इन्वेस्टिगेट कर रहे थे, हाउ जीका केम टू केरला, त्रिवेंद्रम ड्यूरिंग दैट पर्टिकुलर. तब हमने आसपास के एरियाज में ये देखा कि कहाँ के माइग्रेटरी वर्कर्स, जैसे राजस्थान के, जहाँ पे कि पहले हम जीका का आउटब्रेक झेल चुके थे जयपुर में, वहाँ से तो उन मजदूरों के माध्यम से तो जीका ने वहाँ एंटर नहीं किया। तो मीन्स सोर्स को ट्रेस करने के लिए अगर हम ये कर रहे हैं तो देन इट बिकम्स ऑल टुगेदर ए डिफरेंट थिंग। सो देयर आर टू सिचुएशंस। थैंक यू।
Rightly stated, sir. The objective is to find out, we should always stick to our basics, the early warning signals. So that early warning signal may have, it will be useful for the district where the infection was acquired, because the conditions may be prevailing in that district or that state from where he had originated. He may have been detected in this particular state or this particular district, but the early warning signals and the actions are more important for the origin district. Interestingly, we also saw this happening at the international level, sir. When we had the Mpox case coming to India, immediately they wanted to know. That is the purpose of cross notification. The state where, the country where he was living, they wanted to know as to where he was living, what were the conditions, who were the contacts, so that they can, because the outbreak was happening in that particular, it was detected somewhere else in India, but it happened somewhere else. So this is the objective and the goal of cross notification. While we understand that there are pressures, various kinds, that how many cases happened in our jurisdiction, that should also be accounted for. But properly put together, properly categorized, I think it would achieve its purpose.
Yes, Dr. Pankaj.
Sir, my one point is like what we faced in our state, like sir, when we are dealing with dengue, so bhale sir number kam hai, but if a patient is diagnosed in Dehradun and address is from Chamoli, so what happens now, sir? We know that in Chamoli right now there is no transmission. We confirm it through vector surveillance and all these things. But we finally defined that if the patient is diagnosed within the maximum incubation period, then it belongs to Dehradun. सर व्हाट हैपेंस फाइन इट्स की IDSP का जो ऑब्जेक्टिव है कि अर्ली वार्निंग सिग्नल्स को डायग्नोज करना है, बट इवन इफ वी जनरेट अ नंबर ऑफ केसेस, तो डेफिनेटली सर कुछ डिस्ट्रिक्ट्स अगर दूसरे डिस्ट्रिक्ट में भेजेंगे पेशेंट्स को, मतलब उन पेशेंट्स का कुछ तो फाइनल आउटकम होना चाहिए कि वो किस डिस्ट्रिक्ट में रहेगा। मतलब बहुत सारे पेशेंट्स लोड हमारा जनरेट होगा, तो हम सिर्फ इस पे नहीं छोड़ पाएंगे कि कहाँ हमें सिर्फ अर्ली वार्निंग सिग्नल लेना है। अगर कोई डिस्ट्रिक्ट रेफर करता है, पेशेंट को ट्रांसफर आउट करता है, तो दूसरे डिस्ट्रिक्ट का दूसरे स्टेट को उसने एक्सेप्ट भी करना होगा। वी हैव टू फाइनली डिफाइन द फाइनल आउटकम ऑफ दैट पेशेंट। मतलब दिस इज वन ऑफ द चैलेंज व्हाट आई एम फेसिंग व्हेन वी आर डीलिंग विद मोर देन 30 केस कंडीशंस इन वन पोर्टल, सर।
Yes, Dr. Pankaj, absolutely right. Even Himachal also has the same problem with respect to the migration, and they have started this screening for the migration workers. But what I am saying is, even if you screen, and if the people have been migrated there long enough, which has covered their incubation period within the particular district, that has to be treated as the resident of the particular district, and you need not cross notify to from the particular state from where they have come, because it doesn't matter. It will not help also. So those things have to be worked out clearly, and that has to be taken care, and also your DSO should be particularly oriented on this regarding the incubation period, what is the case definition, and how they can be cross notified. So these are very particular for using this phenomenon.
So एक हिसाब किताब करना है, इसका जो पार्ट है दैट इज किस डिस्ट्रिक्ट में, विद इन द स्टेट इट इज ईजियर, यू नो सब कुछ देहरादून में डाल दो क्योंकि वहाँ सब कुछ होता है। चमोली में नहीं दिखा सकते एक भी केस डेंगू का, बिकॉज वहाँ डेंगू नहीं होता है। वहाँ दिखाया तो बहुत सारे सवाल उठेंगे एंड ऑल दैट, बट द पॉइंट इज वन इज अकाउंटिंग देम प्रॉपरली, which you would best understand the scenario that prevails in your state. As I said, there's lots of factors that come into play. But the other part is our epidemiology, our technical knowledge, which is that yes, I am suspicious that this infection may have been acquired in Chamoli. That means वहाँ पे कुछ ऐसे conditions prevail कर रहे हैं जो कि at least एक second लोग warrant करते हैं, एक investigation warrant करते हैं. That is within our hands.
We have to decide fate of those patients where they will.
So वो तो जो एक बार ट्रेन लेट चल रही है, अक्सर वो ट्रेन लेट ही चलती रहती है। So देहरादून में काउंट हो रहे हैं तो देहरादून में ही काउंट होते रहेंगे। It depends on which state we are dealing with.
And last is any other comments on cross notification? Yes, Dr. Utkarsh.
Hello. We get a lot of admissions from cross-border, either from Maharashtra or this Karnataka. So is it possible to edit this cross-notification after investigation? Like my laboratories from district hospital have updated that particular patient as a Goan patient, and then if I want to edit after investigation.
Till how many days that would be required? That is very essential. That's what I was
Maybe
speaking.
within a week's time.
Because it depends on the incubation period. For example, if I'm looking of a longer incubation period disease, say for example, Kerala is having Nipah, this one, and 21 days is the longest incubation period for that case, and we don't know from where that case has come. That is what I was saying.
No, something
that
like
needs to be checked in, and you have to take care with respect to that particular disease that you are dealing with.
Right.
And once you investigate, after that, if you want to change, let us know that this is what we are facing in. But because this is a newer feature, yes, sir.
Because I related this with KFD, what we gave a diagnosis to Maharashtra.
So we should have a provision wherein these cross notifications can be edited or withdrawn also. They may be rarely put into use, but that feature should be there.
That can be given to state level.
Yeah. Only at the state level.
So
yes.
right to now, as we are having the delete function, we can give one edit function also for the essential field. So that can be
At the state level.
And as
Okay.
Dr. Himanshu said, even if there can be a feedback mechanism to the states, again, what has happened to that particular case, especially for something like liver diseases, not for something like ARI.
Sending to the state where it has been cross-notified till the time they complete that loop.
Right. Dr. Deepa, you had some point?
So I was just adding on to this cross notification. We are, if notifying any case to neighboring state or districts, first thing is that from where the patient has got the infection. Second thing is that if the patient is not living in the incubation period in our state, and it's sometimes that some relatives or somebody is visiting that person during the incubation period, and he might get the infection, he comes back to our state. So that is also important during the cross notification. It's not the first person who has got the infection, the second person or the relatives who are visiting that person, they may get the infection back to the state. So that is also very important. If we cross notify it, we can at least have some preventive and control measures in that in our state also, and we can trace more cases if they are.
Yeah.
Thank you.
I think दीपा she is very right. मैं वही बात कहना चाह रहा था. एक तो इन्फेक्शन कहाँ से लगा, दूसरा इन्फेक्शियस स्टेट पेशेंट की जिस जगह पे है जहाँ पे वो और ट्रांसमिशन को सपोर्ट कर सकती है, वो भी एक इम्पॉर्टेंट है. पेशेंट को डेंगू भले ही वहाँ से लगा हो, आज हमारी डिस्ट्रिक्ट में आके, हमारी जगह देहरादून में आके इन्फेक्शियस है वो, वहाँ पे वेक्टर्स भी हैं, तो वो डेफिनेटली इट इज़ ए कॉज ऑफ कंसर्न फॉर अस ऑल्सो टू एज फार एज द पब्लिक हेल्थ मेजर्स आर कंसर्न, नॉट अबाउट द ट्रीटमेंट, दोज पार्ट्स आर ओके. Second aspect is this is also important from point of entry perspective. So the international perspective, I think that was also
Yes,
to be
sir.
highlighted. Thank
Yes.
you.
Sir, just a technical question, sir, with Dr. Shyam. There are three boxes, sir, local, cross-notified in and cross-notified out. So can you have one tick where we can get all the three cases at the same time? Because when we click cross-notified in, it automatically deactivates the cross-notified out cases. And if we select cross-notified out, then cross-notified in case excluded. So if we can have all the three things in single tick.
Yeah, this is possible if a particular district is selected, but if we are going at the state level, so within the state there may be a duplication of cross-notified in and cross-notified out. So that's why we have not given that option to select all the three when we are at the state level. Filter is at the state level.
If I am seeing at the central level, sir?
Yeah, in that case also that will be an issue. I'll explain to you, that is a technical thing. So within a state there are so many districts. So some districts are cross-notifying to other districts. But when we will be clubbing the cross-notified in and out, so that there will be, one case will be counted double.
Okay.
So that issue will be there. So number will not match.
Thank you, sir.
Sir,
Right.
excuse me, sir, one query.
Yes, Harvinder.
Sir, cross notification needs lot of field investigation and it takes times also. वो डाटा जनरेट करने का, घर जाके वेरीफाई करने का, जो हिस्ट्री ऑफ ट्रैवल, इंक्यूबेशन पीरियड, SR has told, this we are already doing. But for IDSP, we were doing like EWS generation और आउटब्रेक जो डिटेक्शन है, इसका बेसिक पर्पस था. ये जो रिफाइनमेंट वगैरह ये कम्स अंडर डिफरेंट प्रोग्राम, जो पर्टिकुलर डिजीज है जैसे डेंगू या मलेरिया है, हम VBD उनके लिए कर रहे हैं NVBDCP कि वो फाइनल लाइन लिस्ट है. तो आर वी मूविंग टुवर्ड्स दिस थिंग कि फाइनल लाइन लिस्ट ऑफ एनी स्टेट, फॉर एग्जांपल फॉर चंडीगढ़, वी कैन विजुलाइज फ्रॉम IDSP इटसेल्फ. सिर्फ हम बल्क एंट्रीज देखते थे कि हाँ ये वाले एड्रेसेस हैं, उसका जो फील्ड एक्शन के बाद क्या लाइन लिस्ट आई है वो पेरेंट प्रोग्राम जो मलेरिया डेंगू का है, हम उस पर ही सिर्फ निर्भर कर सकते हैं. तो वो हम मूव कर रहे हैं इसलिए कि हर डिजीज का जो फाइनल क्रॉस नोटिफाइड ये सारी फाइनल लिस्ट वी कैन सी ऑन IDSP पोर्टल.
As of now, yes, the entire positive cases of all the vector-borne diseases, especially dengue, malaria, etc., are flowing from the IDSP to the NCVBDC portal. जैसे वो पॉजिटिव हो जाता है उधर से फ्लो होता है. दे आर ऑल्सो वेरीफाइंग द सेम थिंग. लेकिन जब वेरिफिकेशन हो जाता है, इन्वेस्टिगेशन हो जाता है, जैसा डॉक्टर उत्कर्ष अभी बता रहे थे, इन्वेस्टिगेशन के बाद अगर क्रॉस नोटिफाई हो जाता है, अगेन दैट विल बी अपडेटेड टू द पर्टिकुलर प्रोग्राम डिवीजन. But that will take time as of now, because we don't know what is the current status on that, how many cases will be like that. So we have to check on that. Yes,
उनका concern about कि वो लाइन लिस्ट प्राइमरी जनरेट कौन करेगा. अगर IDSP अपने jurisdiction में जो केसेस डिटेक्ट हो रहे हैं उनकी लाइन लिस्ट करेगा, उनको इन्वेस्टिगेट करेगा, या क्रॉस नोटिफाइड केसेस के अभी सारा का सारा पूरा IDSP को करना पड़ेगा. सो आई अंडरस्टैंड द इश्यू दैट यू आर ट्राइंग टू फ्लैग, लेकिन वो उसका सोल्यूशन मिक्स्ड है. एक तो वो डेटा कुछ तो हमें जनरेट, यू हैव रिसीव्ड अ सिग्नल फ्रॉम सम अदर स्टेट और सम अदर डिस्ट्रिक्ट दैट देयर आर केसेस व्हिच मे बी हैपनिंग इन दैट पर्टिकुलर. सो उसको कुछ तो इन्वेस्टिगेट करके उसके ऊपर क्लोजर या फिर एक्स्ट्रा केसेस जो डिटेक्ट हुए, some part would have to be done with us, by us. Then it flows real time to on IHIP to the concerned program division also. So they would know कि हाँ यहाँ पे हुए हैं. The rest of the part can be done by them.
NCVBDC, yeah.
Yeah, so right now there is as Dr. Sanket explained, there is one-way flow from the IDSP data. For example, for NVBDCP, data is going from IDSP to NVBDCP. So there may be deletion, there may be addition, there may be modifications also. So right now there is no data sync back, but that can be means as the program will evolve. So whatever requirement may be there, so that can be worked out.
Yeah, Srividya ma'am.
Sir, in Puducherry, we have JIPMER. This is a regional institution, and most of the patients, they come from the neighboring state. But they have some relative in Pondicherry, so the address will be Pondicherry address. On verification only, we will get to know that they have come to their relative's house for treatment only. So in such a case, post verification only, we are able to cross notify. And we are doing it offline. This updation is happening. We are keeping it in a spreadsheet. If this backflow is possible, then, because there are a lot of cases, not just one or two. So cases with Pondicherry address, and now we don't know what to do, because it is there in the portal. If we delete, then that particular test itself goes off. So we cannot delete also. In the portal, it shows us Pondicherry. So that is the problem.
So this is not just a problem for you, it is also PGI Chandigarh which faces this issue. AIMS Delhi, although AIMS Delhi doesn't do much of a reporting, but these two institutes, at least I am aware, Chandigarh, PGI Chandigarh especially, Punjab ka hai, Haryana ka hai, ya Chandigarh ka case hai. So when we look at the data coming from these institutes like JIPMER and PGI, we need to have that lens on, that the clustering or the early warning signals may not be from that part, it is from the other parts as well. And we look at it that way when we are looking at your data.
Thank you, sir. Thank you everyone for the comments. Now I would like to call upon, before calling upon next participant, I would like to, sir, Dr. Sujit sir and Dr. Dhariwal sir, Dr. Jagvesh sir, if you can felicitate our speakers. Yes, sir.
It is a pleasure. The real people who are working now.
Only one, sir. He is our internal.
You also need to.
Thank you.
नहीं सर, come. इनके हम इंटरनल रखे, हम सब ये किए.
Oh, अच्छा, I thought
नहीं, ये is our staff.
So cross notification.
Sir, thank you, sir.
We have covered three new things that are already implemented on IDSP IHIP, PNL format, cross notification and community reporting tool. But we are not, of course, stopping here. The IT team of IHIP is working day and night to improve it every now and then, and the new features which are coming up is you will see within next 1 or 2 months, you will see the new user interface and new user experience on IDSP IHIP. And along with that, we will also change the heart of the portal, which is the Abha ID integration. And Abha ID integration will resolve a lot of issues, like one question was asked, like how we will link S and P form. I think Abha is the solution. That will not only link, the current incidence of the infection, but it will, capture all the things that are there on IDSP IHIP on any other portal. So people, users will be able to see the past history of the patient, even if it is captured in other portal. So that patient history will also be available. So all those things will be coming up with the Abha ID integration, which should be completed within next 1 or 2 months. Thank you.
Thank you, Dr. Devang. Now I would like to call upon Dr. Shubhangi for taking up the session on the lab.
I think if we look at the time, we are back on track. At one stage, we were anticipating that probably our session would come to a close a little early, and we can have 2 sessions before lunch. But if we look at it, it's now almost lunchtime. So that's the beauty of technical sessions, that there's lots of productive discussions and action points emerging, which help us fine-tune our strategy. So instead of having another session before lunch, I think we'll come back to our earlier scheduled plan. Right. So we can now break for lunch, and we'll reassemble for the continued technical sessions post-lunch.
Right.
जो आपने दिया ना उसको बोलो ना लगा दे।
मैं बोलता हूँ अरे नहीं नहीं कहाँ जा रखा लंच के लिए कोई टाइम बहुत क्या लगवा दो करना नहीं भाई को